An injury is an athlete's worst fear. In the world of sports, an ACL tear can end a career in an instant. ACL tears are one of the most common, yet one of the most debilitating sports injuries. But how do doctors accurately diagnose them before jumping into treatment? Testing for ACL tears is an essential process in determining the right course of action. And being able to understand the methods involved can mean the difference between a full recovery and long-term applications. So, what is an ACL? An ACL is one of the four main ligaments in the knee joint, along with the PCL, the MCL, and the LCL. It's also known as the anterior cruciate ligament, and it connects your thigh bone, which is known as your femur, to your tibia, which is commonly known as your shin. How does an ACL tear usually happen? Well, it can happen in both contact and in non-contact sports. For contact sports, it can happen in sports such as soccer or even football. And it can also occur in non-contact sports such as baseball or even cross country. It usually happens with sudden directional changes, plodding, twisting, and planting while trying to maintain speed, and especially excessive force on the knee. When an examiner is going to assess a patient, they're going to need some personal protective equipment to not only protect themselves, but also the patient. This is going to include blue nitrile gloves. These are your standard medical grade gloves. They're also going to need a flat surface for the patient to lie on, and of course, the patient. There's two different tests that an examiner can use. They can use a Lachman's test, which is an acute ACL test, or the anterior draw test, which is a variation of the Lachman's test, just with the knee flexed at a different angle. So let's dive deeper into the Lachman's test. The Lachman's test is going to start by lying the patient down on their back. They're going to place their knee at a 20 to 30 degree flexation. They're going to place one hand behind the tibia and the other in the thigh. They're going to try and pull the shin away from the knee. And if there is a forward translation of the tibia, that means that the patient has torn their ACL. But if there's no translation and the knee seems sturdy, that means that they have a perfectly normal ACL. When I said a 20 to 30 degree angle, as you can see here, the 20 to 30 degree angle is where the thigh meets the pelvis meets the floor. It creates an angle that is 20 degrees. Here's the Lachman's test being performed professionally on a positive note. As you can see, the tibia translates forward and the knee does not look sturdy or stable. Next, let's go into the anterior drawer test. It's going to start the same as a Lachman's test. They're going to lie the patient down on their back, but this time they're going to bring their hip to a 135 degree angle, but the knee to a 90 degree angle. Now this time they're going to place a firm grip on the knee, and now they're going to try and move the tibia and pull it away from the knee. If the tibia is able to move away from the femur, that means that is a positive test and the patient has sadly torn their ACL. But if the tibia is stuck and not able to move, that means the patient has a non-torn ACL. For this test, identifying the angle is going to be a little bit different. For the 135 degree angle I talked about, it's going to be from the patient's torso to the top of their thigh. As you can see right here in the picture, it points to the torso and the thigh. Now the knee being a 90 degree angle, it's not going to be towards the floor and through the leg as the other one. It's going to be the knee angle where the knee joint, where the fibula meets the thigh. This is what a negative anterior drawer test looks like. As you can see, there's not translation forward where the tibia is now just sturdy. Viewer discretion is advised on the next slide. This is what a positive anterior draw test looks like. As you can see, the tibia translates very far forward and it's a very drastic change. So what is the difference between these two tests? Well, since they're pretty much the same, it's just going to depend on the examiner's preference. If they're working on a patient that is larger or the examiner is on the smaller side, they're going to probably lean towards the anterior draw test because it's easier to perform and it is more comfortable for them to be. Also, it can depend on situation and room space. So how can you prevent an ACL tear? Well, for the first thing, you can avoid overtraining and putting extra stress on your knee. You can also improve jumping and landing techniques so you're not putting strain on the ACL. And you can make sure that you're warming up and stretching properly. And most importantly, listen to your body. Thank you.